Hey, did you hear that Janelle is pregnant?
Are you serious? With who?
I have no idea.
Oh my god, not surprising.
She is such a sloth man.
It was gonna happen sooner or later.
She's definitely going to get an abortion.
She probably should.
Yeah.
Definitely.
An unplanned pregnancy can be very scary and very confusing. Deciding what to do can be one of the toughest decisions you'll ever make. But it's your job as volunteers at Planned Parenthood to let people know that this is not a decision they have to make alone. There are three choices somebody has when they are faced with an unplanned pregnancy. The first is to continue the pregnancy and parent the child. The second is to continue the pregnancy and make an adoption plan. And the third is to choose to end the pregnancy and to get an abortion. What is an abortion? Abortion is the removal of a fetus or an embryo from the uterus or the womb.
Yeah, I don't know, you guys. Like, a bunch of my friends are saying that they're not taking their birth control pills and they're not using condoms, so if they get pregnant, they're just going to get an abortion.
But abortion is not a form of birth control. Birth control works to prevent the implantation of a fertilized egg in the uterus, whereas the abortion is a termination once conception has already occurred.
I really don't know, though. Like, if I go through with this abortion, is that going to affect my ability to have kids when I'm older?
Well, after the abortion occurs, your womb will actually go back to the way it was before. So later on in life, when you want to get pregnant again, it shouldn't affect that.
I'm just really scared that people are going to think I'm a slut now that I'm pregnant and I'm considering getting an abortion.
Getting an abortion doesn't make you a slut. Abortion is for some people, it's not for other people, and it's your choice to make. You don't owe anybody an explanation, because it's completely up to you whether or not you feel like you can give a child the life it deserves, or if you're ready for that right now. So when you're helping somebody make this decision as to whether or not abortion is for them, it is extremely important that you let them know about the risks and the safety concerns that can be associated with abortion. So generally, abortion is safe and effective, as long as it is done by an experienced and a licensed doctor. And like there are risks with any surgical or medical procedure, the risks are greater later in the pregnancy than if the abortion is done early in the pregnancy. The risk increases with the use of general anesthesia or sedation. Some other possible risks include allergic reaction, blood clots in the uterus, incomplete abortion, which is what happens when a part of the pregnancy is left inside the uterus, infection, injury to the cervix or other organs, and very heavy bleeding. Actually, most of these side effects are very simple to treat as long as you have appropriate medicine and other treatments. So there are two places you can go in the province of Newfoundland and Labrador to get an abortion, both of which are located here in the city of St. John's. The first is the Health Sciences Centre, where you have to have parental consent to get an abortion if you are not over the age of 19. At the Athena Health Centre, anyone can go there to get an abortion, regardless of age or social status, and parental consent is not required. However, they do encourage an adult accomplice, since you are not permitted to drive after undergoing the procedure. Abortion is also free in this province and is inclusive to everyone who feels that this is the choice for them.
As volunteers, there may be a lot of service users that come to you misinformed about STDs. Other times, service users may feel embarrassed to ask about these myths. It is important for you to be aware of these common myths and how to approach them. Fact: STDs don't discriminate. Rich people get STDs, poor people get them, athletes get them, math geeks get them, CEOs and professors get them. Even someone having sex for the first time can get an STD. The only people who have no risk of getting an STD are people who haven't had sex or any kind of sexual contact. As volunteers, it is important for you to inform service users that if they have sex, to always use a condom. Even if they are already on another kind of birth control, like the pill, you should inform them to always use a condom. That's because condoms are the only type of birth control that reduces the risk of getting an STD. Fact: there are often no signs that a person has an STD. Even doctors can't tell by looking if a person has an STD, so they need to do tests like blood work. People with STDs might not know that they have them. STDs don't always cause symptoms, but it is possible to carry and spread the virus without ever having an outbreak. Untreated STDs can add up to serious health problems like infertility or pelvic inflammatory disease, which may land you in the hospital. Fact: anyone who has had unprotected sex, regardless of the number of partners, is at risk for STDs, including HIV. The only way to know is to GYT, get yourself tested. Fact: withdrawal or pulling out is not an effective means of protecting against HIV or other STDs. The only option that protects against STDs is condoms. For maximum protection, you can advise service users to use both a form of birth control, like the pill, with condoms. Fact: many STDs are curable and most, including HIV, are treatable. The sooner a person knows if they have an STD, the sooner they can get treatment or take steps to prevent passing it on. There are different treatments for different STDs. If healthcare professionals provide antibiotics to treat a curable STD, it is important that they continue their medication until it is finished, even if their symptoms have already gone away. Also, they should avoid having sex until their infection is fully cleared. If a person has a non-curable STD, like herpes, remember that medication is available to treat any symptoms, and daily therapy is available for people with outbreaks to reduce their chances of passing the virus on to partners. Fact: sexually transmitted diseases or infections cannot live outside the body for a long period of time, especially not on a cold, hard surface like a toilet seat. Plus, they aren't present in urine, so the chances of a person catching one from whoever used the bathroom before them are slim to none. What a person needs to worry about is skin-to-skin or mouth-to-mouth contact. Kissing, for example, can spread herpes, and deep kissing can even spread oral gonorrhea and chlamydia. While skin rubbing together can pass infections such as genital warts, herpes, scabies, and pubic lice. Fact: almost all STDs that can be passed through vaginal sex can also be passed through unprotected oral and anal sex. The possibility of contracting an STD from oral sex is generally less risky as compared to vaginal or anal sex, although any unprotected sex with someone who has HIV or an STD carries some risk. Unprotected anal sex is riskier than oral or vaginal sex. Fact: one condom does the job. Latex condoms manufactured in the United States are tested for holes before packing. Advise service users that before they engage in sexual activity to check the expiration date and make sure the condom hasn't been damaged. Fact: the only way to prevent the spread of STDs is to use a condom. Having sex in a hot tub, sex standing up, douching after sex, and jumping up and down will not reduce your risk of acquiring an STD. Fact: although there is medication to help those with HIV live longer and healthier lives, there is no vaccine to prevent HIV and there is no cure for those who are already infected.
As volunteers at Planned Parenthood, it is crucial to be aware of some of the common misconceptions about sexual health. I will identify some of these myths and provide possible responses you may use if asked by service users. It is important to note that service users may not always feel comfortable asking about these misconceptions, so having an understanding beforehand could make a tremendous difference in your work with them. We will cover areas such as HPV, cervical cancer, and Pap tests. What's important to know is that cervical cancer can almost always be avoided with screening and vaccination. In fact, 90% of cervical cancer can be prevented with regular Pap tests and following up on any abnormal results. So why get a Pap test? A Pap test, or what some used to call a Pap smear, is part of cervical cancer screening and checks for changes in the cells of your cervix. It's a very quick test done right in your healthcare provider's office or at a clinic. A sample of cells is taken from your cervix and sent to the lab. The lab then checks for any abnormal cells that may lead to cancer. The single most important reason to have a Pap test is that they can save your life. By getting checked regularly, any abnormal cells that are found can be monitored, and if needed, they are treated before they can develop into cancer. Fact: cervical cancer is one of the most preventable types of cancer. A highly effective means of cervical cancer prevention is regular Pap smear testing. A Pap smear is a screening test for cervical cancer. It is not a diagnostic test, so having the test done regularly is essential. A Pap smear identifies those who may be at high risk for having precancerous or cancerous cervical changes. Fact: regular Pap smears are encouraged until they are medically deemed unnecessary by a physician. This usually happens when an individual turns 65 and hasn't had an abnormal Pap smear within the last 10 years. If you are unsure of when you should stop getting regular Pap smears, consult your physician. Fact: while this used to be true, updated cervical cancer screening guidelines do not require yearly Pap smears. Frequency of testing depends on age, previous test results, and the age at which sexual activity begins. Physicians recommend that individuals have their first Pap smear about 3 years after they become sexually active or by age 21, whichever comes first. Subsequent Pap smears should occur every 2 years thereafter with a liquid-based Pap test or annually with a conventional test. Fact: having many sexual partners over the course of a lifetime is a risk factor for cervical cancer. However, those who have had only one partner can develop cervical cancer also. No one can pinpoint exactly why one may develop cervical cancer and another may not. There are many factors in cervical cancer development. Fact: not necessarily. You'll likely need follow-up tests, possibly a test for HPV or a biopsy to test for cancerous cells. An abnormal Pap test could indicate a precancerous condition that can be treated. Conversely, a negative Pap test does not always mean a woman is cancer-free. About 10% of all Pap tests return a false negative result, meaning the test did not identify a problem that is there. If you have problems such as bleeding or pain, seek further care even if your last Pap test was normal. Fact: cervical cancer can be present without feeling any symptoms. In fact, most people infected with HPV, the major cause of cervical cancer, never experience symptoms. Pap tests check for cervical cancer cells caused by HPV and can detect and treat abnormal cells long before any symptoms are felt, which is why the screening is so important. If you do have symptoms between Pap tests, for example, bleeding between periods, after sexual intercourse, or after menopause, see your healthcare provider. As volunteers at Planned Parenthood, you are not expected to have the answers for everything. However, it is likely you will encounter situations wherein service users are unaware of the myths and facts regarding their sexual health. It is crucial that as volunteers you can provide them with adequate information so they can make the most informed decision regarding their health. In the event that you are approached with a question or concern that you feel uncomfortable answering, you are encouraged to seek further information or direction from a coordinator.
While volunteering at Planned Parenthood, you'll likely need to break the news of a positive pregnancy or STD/HIV test. This process can be uncomfortable and difficult for you if the pregnancy is unwanted. Likewise, nobody wants to hear the news of a positive STD/HIV test. In this situation, it's critical to be honest, have a positive mindset, and provide practical support. Your goals should include empowering the individual to participate in decision making, providing factual information in understandable terms, and creating a trusting relationship between the individual and yourself. In order to accomplish this, you need to assess the individual's level of information and degree of anxiety. To help the individual understand their feelings and explore what they can do about their situation, you can use open-ended questions and reflective listening. If you simply ask yes or no questions, you won't encourage the client to critically think about how they feel and what this means for them. You'll need to explain the individual's options, whether they are pregnant or STD/HIV positive. This includes medical terminology, however, you should also use layman's terms in order to ensure the client understands all options. In explaining these options, you should remain neutral and non-directive. Allow the individual to reach their own decision without letting your biases take center stage. Emphasize there's no right or wrong answer. You need to keep in mind that the client is possibly shocked or preoccupied, so they may not hear all that you have to say, and you may need to re-examine these options at a later meeting. Once the individual chooses an option, you can address immediate needs such as support, referrals, etc. When helping an individual choose an option, you can ask general questions for them to answer, such as, which choices could I live with? Which choices are impossible for me? What would each choice mean for the people closest to me? What is going on in my life right now? What do I believe is the best for me in the long run? What are my plans for the future? What are my moral and spiritual beliefs? And how would my choices affect me financially? When reacting to a client's response, ensure you listen attentively to their concerns. Don't judge the individual's experience, thoughts, or fears. You need to realize the individual in front of you probably already knows they've made a mistake. You shouldn't go into problem-solving mode or take over for them. The individual should accept responsibilities with the help of your services. Hi, Cassandra. How are you today?
I'm good, I guess.
Good. So you know why we're here, though, right?
Yeah.
Remember that we're getting our test results back, and you actually did come back HIV positive.
Okay.
So do you find that surprising, or?
Yeah, I guess.
Well, did you use protection when you were being sexually active?
No.
Did you know that your partner had HIV?
No, I didn't know.
So you know that that's kind of irresponsible, right? Like, you should always use protection when you're being sexually active.
I guess, yeah. Stupid.
Well, you're definitely going to have to seek medical attention now, right?
Okay. I don't really know where to go.
Well, the doctor can definitely help you with that. He'll let you know what your options for treatment are.
Okay. Okay.
And do you know what other resources are available to you or anything like that?
I guess I know of some, maybe.
Yeah, well, there's tons of pamphlets out in the front desk anyway that you can get. So now that you know that you are HIV positive, you can see a doctor, grab some of those pamphlets. There should be lots of numbers for you to call if you want anything else.
Okay.
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 Thanks. So, Cassandra, we're here to look at your test results today, right? That we took last week.
Yeah.
So they did come back, and you are HIV positive.
Oh
Okay.
my god. Okay.
So, how do those results make you feel? Like, what's going on in your mind right now?
I just feel really stupid. Like, obviously, I should have known that was a risk, and it shouldn't have happened.
Well, it was one thing, one decision. It's not going to define you as a person just because the results are positive. It doesn't make you a bad person. It doesn't make you stupid or those things that you said that you feel. That's not what it means.
Yeah, I guess. I just don't know, like, oh my god. Like, I can't believe this is happening to me.
Well, it's totally normal to feel this way. You wouldn't believe how common it is. It really, nobody wants to hear this, right?
Yeah.
So try not to stress over it right now. It is going to have an impact on your life, obviously, but there's tons of options that we can look at for you to take.
Yeah. Because, I mean, like, I have nobody to help me right now.
You always have the center. We're going to be here as long as you want us to be a part of this process. We'll be here. We have tons of services that we can offer you personally, and anything that we can't, we will help you find support for. Okay? So you're not going to be alone in this.
Okay.
So we can go through some options now, any services that we offer,
Okay.
and then we can let you go on home, take a breather, think them over for a few days. We don't want to rush any decisions, and, you're probably a little bit overwhelmed right now, maybe.
Yeah.
So we'll talk about the options, let you go home and think about them, and then when you come back in a couple of days, we'll go through them all again. I don't expect you to remember everything that we're going to talk about right now.
Yeah.
And then we can try to come to a decision. I'll help you wherever I can, okay?
Okay. Thanks.
While it may not be your role to tell a youth's parents they are pregnant or STD HIV positive, it's important to help them understand how keeping it a secret could be harmful and how being honest could be beneficial. Give them time to tell their parents and offer to be present while letting the youth do the talking. Keep in mind there are many professionals who can help you, provide information, and provide support if this problem is too big for you. It's in the client's best interest for you to seek help if you need it or if you don't feel you can provide unbiased support.
As volunteers at Planned Parenthood, you will encounter a variety of different people, including individuals from different genders. Being an LGBTQ inclusive environment, it is important for you as volunteers to understand gender and the many different expressions of gender that exist. We've been taught a normative system of gender that includes a gender binary, two genders, male and female. We have also been taught that our sex and gender will naturally align. That is, if we are born with a penis, our sex is male and our gender is male. However, this script doesn't allow for many people who don't fall in this restrictive box society has made. A more inclusive system of gender allows for many different lenses of gender expression and gender identity. Gender expression is how a person chooses to express their masculinity or femininity through the clothes they wear, the accessories they have on, and even such things as their body language. Gender identity is the gender that one identifies with. A person who is assigned female at birth and identifies as a female is called a cisgender person, or cis. When your gender identity is different than the gender a person was assigned at birth, they may describe themselves as trans. Trans is an umbrella term used to describe anyone who transcends the gender binary. This may be a person who was assigned female at birth but identifies as a male, someone who was assigned male at birth but identifies as a female, and anyone that falls somewhere in between, normally a genderqueer person or non-gender specific person. Living in Newfoundland and Labrador, it is also important to recognize that in Aboriginal cultures, they recognize two-spirited individuals, meaning that an Aboriginal person embodies the spirit of more than one gender. Trans individuals face many forms of discrimination and oppression in society. Therefore, it is important for you as a volunteer to understand that the language you use will be important. In particular, the pronouns you use to refer to a person help affirm or deny their gender expression or gender identity. We have been accustomed to assigning female pronouns to anyone who appears to be a female and male pronouns to anyone who appears to be a male. However, as noted, the system doesn't really work. When you use a pronoun that does not match a person's gender identity, we serve to invalidate their existence. However, when you use a pronoun that the person identifies with, you recognize and you validate their gender. Some individuals may choose to use gender-neutral pronouns, such as they or them and ze or hair. Through using a person's chosen pronoun, you as a volunteer can help break the gender binary and help promote trans visibility. Here are just a few of the ways you can be respectful about a person's pronoun choice. Perhaps the simplest method is to ask the person what their pronoun choice is. For many trans individuals, it will mean a lot for them to have a person directly ask them what their pronoun use is, and many of them will not get offended by you asking. It may be helpful to take the initiative to tell a service user in which you have just met your own pronoun choice when introducing yourself. Although you may be a cis person and this practice is not common for you, it helps to take the onus off the trans individual, and you help to break down the normative system of gender. During conversation, pay attention to any cues that the person may mention, such as the recent start of hormones, which may indicate their gender identity. If there is a third person in the conversation, pay attention to how they refer to the person in question. If you use them here, they or them, it may be safe to presume that that person in question uses gender-neutral pronouns. If you are not sure, you can always refer to the person using their name in place of pronouns, or use gender-neutral pronouns until otherwise specified. During conversation with the person, if you refer to that person using a certain pronoun, pause and ask, "Is that the right pronoun?" and then let them confirm or deny that particular pronoun. This may be a quick and simple way to find out the information you need and continue on with the conversation. It may happen that you incorrectly use the wrong pronoun. It is important to apologize, but be sure not to linger on the apology. By focusing too much on the apology, you make the incident about you, when the focus is on the trans person in question. As volunteers at Planned Parenthood, be sure to use the correct pronoun for the individual even when they are not present. Also, remember that no one knows someone better than they know themselves. So often, identity is confusing and it's challenging, so be sure not to question someone's identity choice. This may be the first time many of you are encountering someone who's trans. There's no telltale sign that will tell you if a person is trans or not. Therefore, it is important for you to take what you have learned and apply to all individuals who walk through that door. By doing so, you will help start a conversation among people, and you help create visibility for trans individuals. Ultimately, you will help promote Planned Parenthood as a safer place.